Hello, my name is Marielle, and I am a mammography student at College of DuPage. I'll be talking about benign and malignant calcifications. Calcifications are white specks that show up in the mammograms. They are a common finding. Although they're seen by the lay eyes as cancer, they aren't cancer themselves. Instead, they are considered just markers for some underlying condition happening to the breast. Calcifications can be divided into classifications: macro calcifications when they are bigger than 0.5 millimeters, and micro calcifications when they are smaller than 0.5 millimeters. Usually, the size is one of the first things that the radiologists look. Usually, also, typically, if they are bigger than 0.5 millimeters and the bigger size, they are less concerning. And if they're on a smaller size, they're a little bit more suspicious. However, to further analyze the underlying condition, radiologists will look at how they are spread through the breast, the shape of each calcifications, and also the amount. According to Dr. Fagan, a radiologist at Edward Hospital, calcifications that are grouped in 5 calcifications or more are a little bit more suspicious than those that are spread out through the breast or they're a little further apart. Women and men can develop calcifications at any time in their lives, simply because of people's physiology and also history of surgeries or injuries to their breast. But typically, they are seen more often in women as women get older, especially when they're 50 and older. Some processes that can lead to calcifications are breast cysts, fibroadenoma, fat necrosis that usually happen in scar tissue due to surgeries or injuries, mammary duct achalasia, which is the widening of the milk duct, which can then fill with fluid and show up as a calcification, cell secretions and debris, which is also known as milk of calcium. Previous radiation therapy for cancer, skin or blood vessel calcifications. This is where it gets a little bit more serious. Ductal carcinoma in situ and breast cancer. The prognosis will depend based on what is causing the calcification. For example, if a calcification is a result of fibroadenoma, the prognosis is equal to the general population because fibroadenoma is a benign condition. However, if the calcification is a result of an invasive ductal carcinoma, which is a malignant condition, the prognosis will depend on each person's diagnosis and treatment. Usually people diagnosed with early breast cancers have a better prognosis than those diagnosed with more advanced breast cancers. The treatment, once again, will depend on what is causing the calcification. So here I have 2 case studies, one showing a 54-year-old woman with no known family history of breast cancer, and she had 3 children. It's unknown if she breastfed them or not. She has history of right breast abnormal calcification on a previous mammogram performed in 2016. She also had a breast fibroadenoma at the right breast when she was 30, and the fibroadenoma was actually removed. So she came back in 2018. They did a mammogram and revealed that the calcifications that were there in 2016 had actually decreased in size and decreasing in the amount. So that raised questions to the radiologist. They also noted 15 millimeter lymph node on the right axilla. So the radiologist suggested for the woman to have biopsy done, and also ultrasound of the lymph node. On an ultrasound, it demonstrated that was enlarged, and also the biopsy came back and diagnosed her as differentiated invasive ductal carcinoma of the right breast. So in this case, the calcification, because they increase in the amount of compared to the previous year, it raised questions, and it showed a malignant underlying condition that was causing the calcification. On the second study, we have a woman, a 59-year-old woman with 2 children, and she breastfed both of the children for 6 months. She did have a history of left breast lumpectomy for invasive carcinoma. So the mammogram was performed, and at 12 to 1 o'clock position, 6 centimeters from the nipple, they found a architectural distortion, and with dystrophic calcification. And also they found a oil cyst, which is typical for when you have typical to develop on surgery sites. So on the MLO position, view of the left breast showed the architectural distortion and the cyst. And then when they did so with that information, the radiologist actually had a BI-RAD 4 to that. And then they did another ML projection, and then that cleared out, and it actually showed as just an artifact, a summer artifact due to the scar tissue, due to the lumpectomy she had previously. They went ahead and they did a ultrasound, and it just showed again the architectural distortion coming from the chest due to the scarring, and also it showed they were able to see the oil cyst. They confirmed there was an oil cyst. And they did a biopsy, a core needle biopsy, and it shows sclerosis and stenosis with associated microcalcification. And then the final diagnosis in this case was a summation artifact, which is a benign condition. And in this case, the calcification actually showed a benign condition happening to that breast. I really hope that was informative to you. It did. It was very interesting to study a little bit more for calcification, and thanks for watching. Thank you.